Over the last few decades, there has been mounting research showing the ways in which singing is beneficial for those living with a range of conditions, including respiratory conditions, dementia, Parkinson's, and mental health concerns. Aligned with this research is the establishment of several Singing for Health groups run by expert practitioners who use a variety of techniques to support those living with such conditions.
Indeed, in Scotland alone, there are over 90 groups across the country, spread across the Highlands, Islands, Central Belt and borders. And new groups are regularly established in various localities.
However, it is not just the act of singing itself that is useful. For some people living with particular health conditions, the inherent well-being benefits of group singing can be hugely enhanced by the opportunity to sing with a bespoke group and to work with a leader who has been trained in how best to support people with specific conditions. In this video, we will be discussing a toolkit that has been developed to help singing leaders support those with mental health concerns.
Scotland's Singing for Health network unites practitioners, researchers and health professionals working in these health-related fields across Scotland.
In this series of 4 short videos, we would like to introduce you to some of the research that demonstrates why singing is useful in supporting those living with mental health concerns. Finally, we will signpost you to where you can find out more about the research and where you can find a group in your area. In this video, we will focus on singing for mental health. Here to share research in this area is Dr. Katey Warren. Dr. Warren is an arts and health researcher and social scientist funded by the Leverhulme Trust and based in the School of Health and Social Science at the University of Edinburgh. She is also head of the PATHS research group based at the school, which stands for Public Health Arts Theory and Sociology, as well as an honorary fellow in the Social Biobehavioural Research Group at University College London.
My name is Katey Warren. I'm a social science researcher and I'm really interested in the relationship between the arts and health. I'm particularly interested in group contexts, so exploring how the arts can support things like social cohesion, community cohesion, and that's one of the reasons why I'm really interested in singing, because it's something that you can often do with other people. I'm an interdisciplinary researcher, so I draw on a whole range of disciplines, including sociology, social psychology, and philosophy, to explore this from multiple perspectives. And I'm really interested in translating research into policy and practice as well. So the main populations that I've worked with are those affected by cancer and new women experiencing postnatal depression. Now, obviously cancer is a non-communicable disease, but we know that the psychosocial impact of cancer can be significant as well. So that's really what we've honed in on in our research, to try and support the mental health of those who are affected. And this doesn't just include people living with the condition, but also staff, carers, those who've been bereaved, or anyone else who's affected by that cancer experience. So we explored whether 3 to 6 months of community group choir engagement could support the mental health of those who are affected by cancer. And we found that it supported a whole range of different facets of mental health. So for example, including reducing anxiety, improving quality of life, improving well-being. And really excitingly, we found that just 70 minutes of singing could reduce the stress hormone cortisol. So this actually showed us that singing was enabling people to become physiologically more relaxed as well. And this is exciting because it shows that singing can affect both psychological and biological pathways that are linked in with mental health. And then thinking about the other group that I mentioned, so new mothers experiencing postnatal depression, I've been working with the World Health Organization to scale up an effective intervention from the UK context into the new context of Romania, Denmark and Italy. So the original trial showed that singing could reduce symptoms of postnatal depression by up to 38% for those who had moderate to severe postnatal depression. This was a really exciting finding because it was actually a controlled trial that compared singing to play as well. So we were actually seeing something quite special about singing. So in this study, we were asking the question, well, can it support new mothers in other environments as well? So it wasn't just about the impact, but also about the feasibility of implementing it, which is so important. Like there are systemic issues to enabling these things to happen. And essentially what we found was that it was feasible and that it did support mothers in these new environments, so supporting with postnatal depression symptoms, supporting with reducing other symptoms of broader depression, improving well-being, improving social support. And we also found that the content and the structure of the singing classes were appropriate in these other environments. There were some challenges, of course, there were systemic issues in relation to the sustainability of the interventions, but it's exciting because it shows us that this is something that we could scale up in the future and support more women. So all in all, what these studies really show us is that singing can support a whole range of different people and support a whole range of different facets of our mental health. In recent years, there's been this more general shift from a biomedical approach to a more biopsychosocial approach, or a more holistic approach to health and well-being in general. And singing is something that we call a complex intervention, so it affects so many different aspects of our health and well-being, whether that's psychologically, socially, behaviourally, physiologically. So as a multimodal intervention affecting all of these different aspects of our health and well-being, it's a good fit for something that's a holistic, community asset-based approach, in contrast to a more deficit-based approach. And it's something that's easily accessible to a lot of people. So I think that means that it can support more people's mental health in a way that maybe some other treatments or other pathways in the healthcare system cannot. So that's really exciting. And at University College London, we've been building theories and models to understand this complex nature of the arts in general, and really honing in on, well, what is it exactly about arts interventions that are linked in with our health? So we've identified, particularly in the context of singing, that there are these kinds of ingredients, or we call them components as well, that we know are beneficial. So these are things like cognitive stimulation, social interaction, and in the context of a group environment, it would also include things like making new friendships and things like that. And these are underpinning a whole range of different pathways or mechanisms. So as I said, psychological, social, behavioural, and physiological, that are linked in with our mental health. So what we're seeing again is that there are these pathways that support our mental health when it comes to a singing environment, and that's really exciting.
In 2020, Dr. Yoon, Associate Professor of Arts for Health and Wellbeing and Director of the Singing Research Lab at the University of Derby, devised a project called Mental Health Inclusive Choirs, #Singing Side by Side, with the aim of the project to encourage and empower singing group leaders while promoting the well-being benefits of singing together for people living with mental health conditions. Dr. Irons' team of interdisciplinary researchers, which included experts in music therapy, health psychology, clinical psychology, music psychology, choir leadership and community engagement, worked together to develop a singing facilitators toolkit to support mental health inclusive singing groups. Dr. Irons is here to tell us more about this project and the development of the toolkit.
This toolkit is developed using type of research, what we call action research. So it wasn't desk-based research, but it was through lots of discussions and reflecting on our practice with a number of active choir practitioners, singing practitioners. If you are a singing teacher or a musician, that you come through sort of normal way of education, such as conservatoire or a music college curriculum, that then you have learned sort of being really good at your instrument, such as voice. But when you facilitate a group of singers, in particular, or often when they are so-called non-singers, actually it seems that you need more than those musical abilities to provide positive singing experience. So when we did a large-scale survey, we learned that actually those community choir singers would like to wishes that their facilitators, their choir directors had more of people skill, those soft skills, better communication skills than the music skills. So as I said, the current normal music college education does not involve this developing you to do more, to learn more about these soft skills. Hence, we felt that this toolkit can help musicians, singers, practitioners to learn about how best they could provide positive community singing experience.
Deborah Hamilton is a community links practitioner who works for Health and Social Care Alliance Scotland. She works on a one-to-one basis to help identify and address issues that negatively impacts someone's health. This also means Deborah has a vast knowledge of the available activities, organisations, services, such as Singing for Health groups in her area, in addition to the health and care setting which could help someone in her community. Deborah is here to tell us more about her role and how she can help to support someone with mental health concerns in particular.
I have been a community links practitioner for 10 years, so you can tell I love it. I was one of the first in Glasgow to help create the programme, so we went into the primary care teams not really knowing what to expect, what they would be looking for, and really was able to kind of create that role together with primary care teams. Off the back of prior programmes that looked at bridging the gap between the community and health spaces. So we had that bit of background in mind, and then really it was about becoming embedded in the community that I was initially based in. So I love the job, being able to have that foot in the door of a health team and a foot in the door of the community. That's really what the role is about bridging that gap between the health world and the community resources that are out there. GPs are often seen as the kind of castle in the community and the drawbridges up. You've got the dragon receptionists guarding the GPs. I suppose I see my role as kind of bringing that drawbridge down a little bit and just kind of improving that connection. It's really what it's all about. I've seen the first-hand benefits of singing for breathlessness or breathlessness, conditions that have breathlessness alongside it. For me, having worked with patients who've been diagnosed with COPD or even asthma later in life, the emotional, psychological impact of a diagnosis can be really debilitating in itself. So before somebody's even started to experience some of the symptoms in a kind of severe way, being told that they've got a long-term condition instantly affects their confidence, their sense of who they are, what they're capable of. And I've seen folk really spiral with low moods and then an increase in anxiety, which obviously adds to the breathlessness. So for me as a links worker, having a resource like a singing group that supports individuals to learn how to self-manage their health condition, regain a bit of confidence over themselves and change their kind of attitude towards their condition by meeting other people in a really safe, supported environment, it helps them regain control, which has an impact across their whole life. But also their ability to manage even their medications, their every element of their condition.
This is a very brief overview of the research and work that is currently taking place. Scotland's Singing for Health Network website provides much more information on existing research, as well as a map to the various groups operating up and down the country, training courses available for practitioners, and links to our podcast series, where we interview organisations, researchers and practitioners who discuss the practice and research related to singing for health in more depth. Our work is ongoing and we have so much more to share, so please get in touch with us if you would like to know more. Our website address is on screen.